see here. Whoops. What are you doing? Oh, waiting for spring. Boy, you got that right. It's been rainy here and cold. But we have Hannah and Connie and Andrew here tonight with us. Yeah. So, you're welcome, Buffy, and I hope Benji, just keep me posted, okay? I'm gonna just catch you guys all up to date. Well, maybe. Be careful. And I just found out I was all gonna go in and have a really cool bath and have some bubble baths and relax and chill and have my kitties and read. I just found out I can't use the bathroom tonight because they grouted it, and so my orders were to stay out of there. Darn. So, oops. Let me raise it up a little bit.
Bubbles and rubber duckies.
Is that better, Jan? Yeah. Come on, girl.
Boxes, Zelda.
Is that okay now? Is that better? Yeah, it was down a little bit lower, and I think I was talking a little softer. Well, you all know this has been a rough day. We did lose our Sheldon. Just felt really bad about that. Such a nice little kitty, just purred and purred and purred. He just got clobbered by that car, and you know, we don't know what all is involved in these cats before they come here. We do know he was emaciated, just nothing but bones with skin on, and dehydrated. And we've worked with kitties like that before, and you know, sometimes we do okay and sometimes we don't. But we just could not get his diarrhea under control, and it just got so bad that he was literally wasting away more than what we could help him with. He never really recovered from that. So that was sad. You know, they come in all banged up and a mess, and you just want to help them so bad, and that was just a toughie. So, but he passed away knowing that we cared, because he would come up to the front of the pen. He was in the front thumper's room, and every time we would go by, excuse me, we would always stop, and even if we couldn't reach in and touch him at that moment, we would talk to him, and he always responded to us. And so I think he knew he was well loved. And then little Michaela Sue here is doing really good. She's being loved on by Connie right now. Isn't she a doll? She really is a sweetie. So I spent a little bit of time and wrote down everything about our two kitties so that I could, my brain hasn't been functioning too hot today, so I wanted to make sure I didn't miss anything. So I just spent a little time on the computer, and I'm just going to, I took my notes of what Dr. Darcy and I went over. Oh, thank you, Lost Girl. Thank you, Dark Cat. That means a lot to me. Yeah. I took my notes and just wrote everything down so that I didn't miss anything. Well, I probably still did. And I wanted to tell you about Bella and then Vivian. So Bella, the last couple of days, many of you know that Bella's rear leg ballooned up about 3 days ago, I think it was, from the hip to the toes. It was thought that I thought maybe she had an abscess from maybe a bite wound or an injury, but I could not find a point of injury. So I was a bit mystified by that. I checked her over half a dozen times and could not find any bite wounds or any puncture, anything like that. After talking to Dr. Darcy a few days ago, she wanted Bella started on 2 antibiotics. It did seem to be a tiny bit better yesterday, but not great. And last night I noticed that her 2 front paws were also a bit swollen. And this morning Lisa and I both noticed they were a lot swollen. Obviously now this didn't seem like a bite wound, but something else was going on. And I also noticed this morning that when she would walk or scoot, as we say for Bella, she was leaving a Bella trail, very similar to a trucker trail, of what I thought was urine because it was yellow, but Bella has never done that, so I wasn't quite sure what was going on. And so she was sent along with Vivian to the vet's office. When she arrived for Dr. Darcy to examine her, she was shaved a little bit on the upper inner thigh where it was wet at. And by that time, by the time she got up there, she was pretty wet. And Dr. Darcy found not a bite wound, but she did have 2 holes there. And this was from the extreme amount of fluid buildup that was now there, and it leaked out. The skin gave away. And you might have seen people when their legs are so swollen that they get so tight, there's no place more for the fluid to go, so it breaks through the skin and leaks out to give relief. Dr. Darcy took some of the fluid and examined it under the microscope. She saw a lot of fluid-filled tissues and cells. She then did an ultrasound, and it showed an inflamed area, a large inflamed area. Hi Pat.
Hi.
Her diagnosis was paniculitis. You guys might have heard of this before. It's not that common. And if you want to know a little bit more about it, I will give you the spelling on this. It's Paniculitis, paniculitis. And it's a condition where a layer of fat just under the cat's skin becomes inflamed. This fatty tissue then concentrates, gets thickened, and turns into a nodule. That's why her leg got so big and so hard. And this is not very, very common. The inflamed tissue can break through the upper layers of the skin and create, like the sub-Q layers of skin, and create a visible lesion on the surface. And that's what happened to Bella, was that it just got so filled with fluid, there was no place for it to go other than to come through the sub-Q fluid, or sub-Q layer of skin, and relieve that pressure. Sometimes a secondary infection can set in. The areas involved may be sensitive, especially immediately after rupturing. The discharge is yellow, which is why it looked like urine, while the outer skin may turn red, brown, or yellow. It sometimes can be called a sterile abscess because it's non-infectious and there's no bacteria involved in the initial thing, in the initial nodules that's there. There's really no definitive cause other than sometimes a wound or a physical injury may be the source, but not always. There's no risk to the general health of the cat, although there is pain and soreness. Now that the inflammation has surfaced to the skin, this is our worry, is that bacteria and other pathogens can enter into the wound. Keep in mind, Bella is a scooter. She's not one cat that gets up on her toes and walks. So she's even closer to the ground, and as clean as what we keep our floors, there's still bacteria there, and that's what we have to worry about. So Bella is on antibiotics for secondary worries. The treatment of choice is an anti-inflammatory, not necessarily an antibiotic for those cats that don't have to worry about a secondary infection. Isn't that interesting? and that's a steroid. So Bella's now on the steroid and an antibiotic because of our worries about bacteria entering the wound that she has now. Bella's lab work results, her kidneys are good, so that's good. Her white blood cell count is up, but that's as it should be because that tells us her body is fighting this. She has immature red blood cells, and that's good because that is showing that her body is generating new red blood cells. So all those things are good, and the first thing that Bella did when I put her on the floor was to go eat. So I was very happy about that. So that's Bella's. I'm not quite sure where she's at right now.
She's under the tree.
Is she sleeping or is she watching us?
She's kind of looking at us.
Looking out. So Bella's over there under the tree, Connie said. And this may take months. She may have to be on her
drooling.
steroids. And is she licking her back?
No,
leg?
she's just drooling.
Oh, drooling?
She's
drooling?
got dripping from her mouth.
Okay, I'll look at her tongue. Make sure there's no lesions on that. Okay.
Looks like water.
Okay, so she may have to take the steroids for months. Hopefully, with if they don't use, I know somebody's going to ask this. They don't use oh gosh, my brain. Blah. Oh. Come on, somebody help me. Pee pills. Oh, for Pete's sake, guys, I can't stretch my brain anymore tonight. What do folks use when they have too much edema? They take
Water pills.
a water pill, but there's another name for it. It's
Diuretic.
diuretic. Oh my golly. Whoa, that really took a lot of effort to get that out. Thank you. My brain just wasn't going to go there.
Oh, I just beat somebody in saying it too.
It was there, but it wasn't here. They don't use that for that, so they do go with the steroids. She is not going to go outside for right now. No, it's too icky anyhow, and we don't want her to do that. No. I hate that when you know what it is, but it won't come out your mouth. Yeah, sounds like. I was thinking of Lasix. I should have just said Lasix, then all of you would have known that. So they don't use that. So she said it's very possible that she will be on this for months until these symptoms subside. And yes, it is like cellulitis, and it does get sore. Yeah. 2 problems in 5 or 6 years. Yeah, that's right. But boy, when she does it, right? That Bella. And then we come to Vivian. Just a little overtired. Okay, Vivian. Does anybody have any questions on Bella before we move on? So Pat,
Yeah.
that's Vivian in there.
Mm-hmm.
My problem is, I really want her in there so I can watch her.
Mm-hmm.
We do still need to put Vernon away for the nighttime.
Mm-hmm.
So he can, if you want to make up the cat's corner room, put some blankies in there and food and water, he can go in there for nighttime. Yep, makes you pee and get rid of all the extra fluid.
Hi, Mary.
I hear you, Queen. Well, Bella was wondering about that. I told her just don't pick Janessa. Yeah, maybe, well, Coralie, yeah. Yeah, gosh, isn't it crazy, you know, some of these things that can happen? And so we'll go on with Vivian. I just love her name because it has 2 V's, 2 I's, 2 E's, and 2 N's. I just think that's so cool. I told Connie that. That's crazy, but I think it's cool. Vivian also has something strange going on. So her FHO, that's her surgery we were going to do to, oh my gosh, will you help me remember when I'm done to call Donna that to tell her that surgery's canceled? Because that was her ride up there. I have to do that. Her FHO was canceled today. When Vivian first came in, she was hit by a car. As you know, she fractured her femoral head, and upon arrival, her urine was very bloody. That did get better after a few days. We did start her at that time on a little bit of anti-inflammatories, a light dose, and some antibiotics. I definitely noticed that she was still having a bit of trouble urinating. She was just going in very small amounts. Last week, we took her up for a regular ultrasound because of our concern about the bladder. And this showed at that time that the bladder was intact, and that was what was checked, was her bladder, and everything was okay with that. It was felt that her urinary problems would get better. She had probably bruised her bladder by the car impact, and she was also placed on antibiotics at that time. This morning, though, she was running a temperature, and so I knew right then that she was not going to have her surgery. And I also noticed that she was in the litter box frequently and just could not pee. But I did feel her bladder, and it wasn't that bulging, horrible bladder where it's just tight with urine. So she had to have peed during the evening sometime, I'm sure. So because of her fever and the bladder, or her not being able to urinate properly, there was no way we were going to do her surgery. The FHO is an elective surgery. In time, we will decide when this will be done. Right now, we will concentrate on her kidney problems. So this morning, she was taken up to Dr. P's office, and Dr. Darcy worked on her. The following is what was found. It's polycystic kidney disease, and it sometimes is called PKD1. PKD1. No. Now the car could have hurt her bladder. We definitely think that that's in the picture, but the polycystic kidney disease was already there. The polycystic kidney disease is the most common, now get this, inherited renal disease of cats. It progresses slowly as portions of the kidneys are replaced by cysts. These cysts then compress the function of the kidney, thereby decreasing the kidney function overall. Cyst numbers and rate of growth are highly variable from cat to cat. This PKD affects approximately 6% of cats, but it may affect up to 37 to 50% of Persians and Himalayans, and some studies show Siamese. Some studies say Siamese is in a lower bracket than that. Sometimes, because of the high rate of this polycystic disease for those particular breeds, sometimes breeders do genetic tests to determine if the parents may be carriers before they breed them. It can affect any breed of cats, though. They generally do not live a full life. There's no definitive cure. Condition is inherited. It's irreversible and progressive. Polycystic disease has to be diagnosed by ultrasound. It's one of the key things you do in diagnosing this. And it's called a fast 4-point. And see, when Dr. Darcy did an ultrasound last week, she concentrated on the bladder. But because of the increased potty problems, her brain was already thinking of kidneys. So these are called a fast 4-point. It's where the kidneys are ultrasound on all 4 corners. And this is weird. The kitty has to be on its right side in order to get a proper reading of these kidneys. The cat must lay on its right side to be checked correctly. Vivian's kidneys, as Dr. Darcy says, looks like Swiss cheese. Yes, it's caught early. No, we don't know what her future will be. She also did an ultrasound again on the bladder, and that is intact. Her BUN and creatinine, those are indicative of the kidneys, is normal for right now. Her culture and sensitivity of the urine is still being ran. We'll know more on that tomorrow. She is borderline for the white blood cell count, and that's fine. That is okay. There shows no blood or crystals in her urine right now. What is abnormal, though, is that the urinalysis shows that the urine is not concentrated, and this is an early sign of kidney failure. Young cats, such as Vivian, should show a very high concentration of urine. The other thing that worried me a little bit is when she had her ultrasound last week, that was Friday, she was 508. Today she's 503. So, and you and I both know that could be the difference of a little poo or not. But she also hasn't been eating that great either. I do know that. Vivian may live years and she may not. We don't really know at all and will not make any predictions at this time. In the meantime, we will give her antibiotics until the culture and sensitivity is completed, but we should know that tomorrow. Dr. Darcy also wants her bladder expressed twice daily to let the bladder rest and not be taxed by her constantly trying to empty it. This will also help with the inflammation. And Dr. Darcy also felt that there might be a little bit of nerve damage to the bladder not from the kidney disease, but from the car accident. So she's actually got two things going on. Packer, we have in the past, but it's been quite a long time. Yep. So that's it on Vivian, but I'm always the supreme optimist here, and we'll see what happens. I sometimes go overboard in being optimistic, but that's just the way I am, and I can guarantee you that's the way I will continue. Right now, she's not going to be on a special diet right now. We're going to wait till all her tests are in and get her eating better, and then we'll explore that. I think I have Vivian down as only 10 months, very young. If our goal is to have the FHO surgery later, not now. The kidney issues is prime. What we need to do right now is just, we got to get her peeing easier. And that's why we're going to do the express the bladder, so that she's not in that litter box every 5 minutes trying to get urine out. That increases the inflammation in that bladder, and that just does no good. So we can help her with that by expressing that bladder just twice a day. So we'll see how things go. Oh yeah, I know that Royal Canin kidney one is fairly palatable to the kiddies. She is so young, yes. Yeah. I've told everybody better enjoy things while it's quiet. The last month has been quiet here. I keep saying better enjoy it. It's femoral head osteectomy. It also goes by other O names, but what that is where the head of her femur is fractured, and they will eventually, we hope, to go in and just take that femoral head off, because while it's there, it just is a rubbing. Like if this is her femoral head, or her femur, that femoral head, that knotty knuckle thing that sits on top is floating about. It cannot be pinned, and it does cause some irritation and some pain there. But as you know, with cats, they are awesome, and that their healing ability is awesome when it comes to bones, and eventually that head will set someplace long enough that it will calcify some way, but probably not in a way that will be very compatible with smoothness for her walking. So the best thing to do is take that knuckle bone off, and then this flat part here will lean up into the pelvis, and it will form its own like little socket. And the leg may be a little bit shorter, but in the long run, especially when she's an older girl, it doesn't cause as much problems as leaving that head on in a abnormal position. Hope that all makes sense. Cats are notorious for hiding pain. They are amazing at that. So, any questions? Everybody else is doing good.
I brought you that stone cat.
Oh.
I put it over in the angel garden
Okay,
for now.
I'll go take a
Peggy
look
can
at
move
that.
it where she likes it.
Did somebody come?
Nope,
No,
I didn't get to claims this week. My gosh, it's been a
Crazy.
horrible week. Horrible.
like pick up Nike Sam, I don't know, you expecting Sam?
Oh, yes, yeah, Sam's coming.
I got about 100 of these made.
Awesome. Okay, I'll take those. Oh, Farrah needs some padding. She's needing. Oh, yes, definitely, JMU, yes. On the polycystic kidney disease, that there is no cure. It is inherited, it is irreversible, and it is progressive. She already said, you know, oh, I heard about that.
What?
The station, the space station will be flying over at 9:30 something. Yeah, we saw it the last time it went. It was really awesome. So, you know, her kidneys, she said, already look like Swiss cheese, but what happens is they develop more and more cysts, and as the more cysts are developing, those cysts take over or make it so that the kidney cannot function properly like it normally does. So, but that doesn't mean it's fast. Some cats, this does go fast. Some does not. She's young. I am well thinking that we're going to be fine for a long time. That's just the way I'm going to think about it. Seymour is wonderful.
Oh, I'm not putting this down for you. He's
so ornery. You know what? He knows, you can tell by his face when he's going to do something he knows he's not supposed to do. And if you look at him and say, Seymour, he goes to the door like, okay, I better go back to the front part. He's such a nut. Yeah, Vivian is back.
There's a pay station. What is that?
Yep, we hope that we can still do the FHO once we get the bladder healed. The kidneys we can't do a whole lot about. The bladder we can. Once we get the bladder healed more from her car accident and she's urinating properly and is gaining weight again, then we can pursue the FHO. Keep on keeping on. You know, from when I worked at the vet's office, I don't think the PKDs are painful, but it's,
Where you
you
going?
know, they certainly, as it progresses, don't. It's like a kidney disease. It's all the things that go along with that. I haven't done Farrah's meds. I got to do that.
Did your mom like the lights? I didn't see that they were up.
We haven't done her summer stuff yet.
You might want to take, since I gave you a lot of solar
Yes,
lights
Dave.
last year, maybe some of those could also go. I didn't realize that path was kind of long.
Okay.
Probably could use a few more lights.
Do we know where Samson Wolf is, just real quick?
Let's see, that's Coral Lane.
He's the great gold
Yeah.
boy.
Well, gee, I'm surprised he's not out here because they
Yeah.
did bring baby
Yeah,
food.
he loves his baby food.
He's one of the pigs.
Yeah, there's a baby.
I haven't been seeing him since we've been here. He was that's not him. Is that you? No.
He's really orange too.
The station. Exciting opportunity. I can see anything.
Oh well, everyone else is ready for this. Come on, babies, kitty, 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 kitty. Kitty, 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 kitty. You're not a kitty. You're not a kitty. You got ears like a kitty, but you're not a kitty.
He doesn't have the stripies like what the other gold ones do.
Oh, see the pattern I found. Cat butt coaster.
Oh, I seen that.
Hard to find good cat colors though.
So, he's from Grandma.
Yeah.
Put this down.